I work in global mental health, looking at perinatal mental health in women in rural India. I did a master's in political science and international law, and I also studied psychology, and I did my PhD in global mental health. I am interested in equity and developing health systems that are accessible and equitable. And so I've been really interested in what we call health system strengthening for mental health. That is, developing systems in areas, particularly low and middle income countries, where we don't have systems for mental health or where there's very little services or access to mental health care, and improving these and developing these further. One of my main research areas is the Smart Health Pregnancy and Mental Health Program, PRAM, a program that looks at developing a community intervention to support women in rural India who are pregnant and in the first year after birth with their mental health. What we're looking at this stage, we're very early days, is understanding what is it that women in rural India need, what is it that the community needs, how's mental health being understood in these communities, what support do the women need, what concerns do the women have. Challenges that we see, for instance, are poverty or sort of making a livelihood for these women. They're competing responsibilities that they may have for their own families, taking care of their kids. There is also, to some extent, domestic violence as a topic that needs to be considered in approaching mental health. So stigma is a key factor, we know, for inhibiting people from seeking care. It is a main factor for people not providing care to women and to anyone experiencing mental health problems. And so we're identifying ways to best address stigma and reduce it, and reduce discrimination to support women and people in these communities. I like living in Oxford. It's a great place if you're an academic. Of course, also the college life. So I'm part of Wolfson College, which is a very open and welcoming society. To have access to these very particular support services, so having a network of other researchers where you can exchange ideas, where you can talk about grant applications, where you can talk about the challenges you face, but also, making connections to people who are working in India, maybe in a different field, or who are working in Oxford on a similar topic. I've made great friends and colleagues in my college or through my college and the university. I think there are three key challenges that need to be addressed. Integrating mental health interventions into wider health and social systems approaches. I think addressing stigma is a key issue as well in the future, because it's the main barrier that holds people back from accessing care, but also policymakers from even setting policies and implementing these policies. And including people with lived experience is a key factor. So we know that the main driver of reducing stigma, the main component, is social contact with people who have lived experience of mental health problems. And so including these into research and into practice and implementation of mental health interventions is critical. If I had that funding, I think I would try to get together a very interdisciplinary group of people, of researchers, of practitioners, to identify what is needed, what are priorities for people in particular settings around mental health, and then to implement approaches that contribute to sustainable solutions for that. This is not just low and middle income country settings. This is in the UK, this is in London, this could be South London, it could be, I don't know, West Oxford. My main tip would be to, in the first place, watch out for your own mental health, to take care that you're balancing your research, your work and your private life.